Now we will discuss about the basal cell carcinoma arises from basal cell of Malpighi body of the skin. Statement 2 is basal cell carcinoma spread rapidly through lymphatic and blood vessel. It is not lymphatic and blood vessel, so the answer should be that statement 1 is correct, but statement 2 is incorrect. Okay. Next question is that loose cough with bad smelling sputum, breathe up smell badly in the patient himself. It comes from Allen keynote. The medicine is sanguinaria. Sanguinaria have the bad smelling sputum with breath and the sputum smells badly. Then 60 years old present male complain of myocardial infarction. There will be onset of the pain in the right leg. There will be examination. Leg is cold to touch. Peripheral leg is pulsation absent. Cannot rise legs. Probable diagnosis is your arterial occlusion. Why not others? We will discuss. Verification, comes from SPS. Verification of a diagnosis is the first step of epidemic investigation. Epidemic investigation should be delayed till the laboratory results are unavailable. So it's this line always you should remember, should be delayed. This type of always the statement are negative. So A is correct and R is incorrect. Next question is that pregnancy kit, the NRHM name was what? Nishchaya. That is, you see the names, words are also same, may be confused in the latter period. Then question comes as your question from SPF, that is hard tick, flies, soft tick and sandfly, jodi maker. So here the options you see, sandfly is always comes to the relapsing fever, A ka 2, that is your answer will be A3. Sorry, sandfly is oriental sore, flies is on the bubonic plague, hard tick is your rocky, soft tick is relapsing fever. Then next question is that the standard normal curve, total area of curve is 100. No, 1 is the total area curve parameter, and your mean, median and mode is always coincidence. So statement 1 is incorrect and statement 2 is correct. Okay. Next question, there will be next question is that EBV virus is related to Burkitt lymphoma. It is correct. EBV virus is a nasopharyngeal carcinoma. It is also correct. Mongols are more likely to leukemia than EBV is not so much leukemia condition. Then thermography is more sensitive technique for breast cancer screening than mammography. It is not correct. So answer will be A, B, C. Now the question comes from SPM, least sensitive to heat, which vaccine? That is hepatitis B. Next question, Wilson disease is from which type of genotype? That is autosomal recessive. Next question is that mode of transmission of a typhoid fever is, that is fecal-oral transmitter. Next the question is that biochemistry, niacin, jodi maker question, that is niacin is related to your pellagra, thiamine is related to your beriberi, ascorbic acid is related to scurvy, vitamin B12 is related to pernicious anemia. From ECG there will be a abnormal arterioventricular ratio and abnormally long PI. Your arterioventricular, it leads to what? It leads to at first degree AB block. Next question is that unconjugated hyperbilirubinemia in hemolysis, absence of hemolysis, seen in Gilbert syndrome. Then next question is that allergic bronchopulmonary aspergillosis. There will be dyspnea accompanied with cough, production of a thick brownish plug-like mucus. Dyspnea along with phlox, production of a thick brownish plug-like mucus, that is aspergillosis. In aortic stenosis, what is the clinical picture? There will be syncope while walking. Examination shows slow rising, low volume carotid pulse with ejection of a mid-systolic murmur. Mid-systolic murmur you will get carotid pulse which is a slow volume and your slow rising of a carotid pulse, and a syncope will be occur while walking. That is aortic stenosis. Next question from COPD, changes in the large airway causes cough and sputum. Mucous gland enlargement is seen in asthma. Asthma is not comes under COPD. Next question, next part is the C line statement, tell that increased resistance in the airway more than 2 mm diameter, chronic bronchitis it is happen. and your emphysema also there will be shrinkage happen, and it is also comes under COPD. So answer should be option A. Means changes in the large airway, there will be cough and sputum happen, major site increased resistance in the airways, and a centrifugal emphysema is usually seen in the cigarette smoking. The next question is the chronic hepatitis B. The serological marker is related to liver injury and risk of progression. Which serological marker is our hepatitis B virus DNA? Is the liver injury and risk of disease progression is usually we see from the hepatitis B virus का DNA का. Next question is that stroke of pure sensory symptom is which site. If we get the stroke, then it will be pure sensory type, that is ventro-posterolateral nucleus of thalamus, because ventro-posterolateral nucleus of thalamus is contain the fibers of a pure sensory character. Next question is that thought of broadcasting, which site we will see, that is schizophrenia, thought of broadcasting. A picture of SLE, that is finger joint swelling, photosensitive rash in the face, auto antibody is found. Then which antibody is referred, that is antinuclear antibody. Next question from bronchial asthma. There will be peak incidence of asthma in childhood happen. Lower level of infection is increase in the risk of asthma. Allergic reaction of the food is leads to increased asthma symptom. Exercise is the most common trigger of asthma in children. Most common allergen to trigger the asthma is pollen. So here the answer would be first option, that is peak incidence in the childhood. It is happen lower level of a child, it is lowers at the level of the childhood, and it becomes increasing if the risk of asthma is increases. Then lastly, allergic reaction is food, it is usually not there. Exercise is decrease the triggerance of the asthma. So statement D is also wrong. The most common allergen to the trigger asthma are pollen, that is true. Then most stable angina pectoris, what is the most widely used test, that is SSH ECG. Urinum, there will be what happen, the children are pale, rachitic and dwarfed and stunted with growth, physically and mentally dull and weak people are there. Then your carbolic acid is the, according to Jettican, the antidote of poisonous effect of the stings of honeybee is by carbolic acid. Then next question is that which is the vegetable analog of magphus, that is chamomilla. Then your spigelia, there will be question comes from good remedy for the symptoms due to the presence of worms. It is true, but neuralgia of fifth nerve was prominent in spigelia. In the both statement are true, but it is not the correct explanation. Sorry. Angina pectoris diagnosis is most usually done, that is common, that is SSH ECG, treadmill SSH by SSH ECG. Okay. In case of a CSF, there will be revealed WBC count is more than it shows which type of meningitis, that is bacterial meningitis. Tram tag sign, where the person shows cough with tenacious sputum and there will be wheezing on auscultation, there will be clubbing in the finger. Then chest x-ray, so tram track sign. The most likely to be diagnosis which condition, that is bronchiectasis. From Allen keynote is statement that is a man of 40 years OPD comes with the headache and vertigo, along with they having unable to think, to perform, to act. Headache was exposure to sun ray and gaslight. There will be depression of a spirit, occupied with sad thought. Which remedy, that is natrum car. Next question is that children pale, rachitic, dwarfed, stunted growth, mentally dull and weak is found in which medicine, that is your medurinum. The next question is your Podophyllum. Podophyllum belongs to which family, that is Barbadeaceae family. Lidompa, that is Ericaceae family. Coca, that is Linnaeae family. Symphytum, that is Boraginaceae family. Next question, vomiting in any position except right side, that is your anthem tat. For Allen medicine, that is Bankfos. Bankfos having the beginning from occiput extend to the head. School girl headache, that will be 10-11 to 4 to 5 pm, that is your Bankfos. Your amylation part calcarea first, there is written rheumatic troubles, aggravation in the spring, air is full of melting snow, then your affection of a sudden surprise and joyful surprise, that is your cophia, then dyspnea, dancing, walking rapidly, ambulation, that is sepia, your abuse of mercury or syphilis, massive dose, that is your Oromet. Then which remedy having cardiac stimulant affecting the peripheral vessel and coronary artery, that is squilla. Squilla having carotid artery and a peripheral vessel affected fat. Next question is the Charcot artery of a cerebral hemorrhage is related to middle cerebral artery. The middle cerebral artery, otherwise known as Charcot artery, and it is in the heart stroke, brain stroke, there will be Charcot artery, otherwise middle cerebral artery. It is the main artery. Question is the transpyloric pain. It is comes under AFEGT 2020. Transpyloric pain, body of L1 vertebrae nears the lower border. L1 vertebrae का lower border में the line which is passes through, it's called as transpyloric plane. Anterior two-third of the tongue is transmitted by which sensation, that is facial nerve. From facial nerve anterior two-third is passes. Regarding composition of a bile, the gallbladder bile when compared with the liver bile, what is the difference in them? That is gallbladder bile is content of a more your bile salt and calcium than the pancreatic bile. So gallbladder bile, why? Because gallbladder secretions are mixed up and it causes the bile more concentrated, more bile salt forms and more calcium is comes. In ADH, water insoluble hormone. Reason, because ADH is not water soluble, it is lipid soluble. That's why it needs a receptor for the cell membrane to pass through the DCT. So A is false, R is true. Statement 1, ADH is not a water insoluble hormone, it is a fat insoluble hormone. Statement, basophils release bradykinin, secretin, major basic protein and heparin, whereas eosinophil release bradykinin, secretin, major basic protein and heparin. Both statements are false. Why weight gain in the first trimester is a major contribution by fat deposition. Fat deposition is the major contributor of weight gain in the first trimester. Bone tumor arising from epiphysis, that is giant cell tumor of the bone. Giant cell tumor of the bone is called bone tumor from epiphysis. Jody maker, that is solar radiation, hereditary, human papilloma and benzidine. Retinoblastoma, bladder, basal cell carcinoma, carcinoma of cervix. Papillary, carcinoma of cervix. Solar, basal cell carcinoma. Hereditary is retinoblastoma, benzidine is for bladder cancer. Next question is that saphenous nerve is a branch of femoral nerve. Statement 1 is correct. Statement 2 is extensor digitium brevis is present in the dorsum of the foot. It is also correct. Next question is that from the poisoning, that is carbon monoxide poisoning is cherry red color, phosphorus is dark brown, hydrogen sulfide is bluish green, your nitrate is chocolate color, staining will be found. Chemical mediator of inflammation are derived from the cells or plasma protein. Statement 2, leukotrienes, C4, T4, E4 and thromboxane are causes vasodilatation. Statement 1 is correct, but thromboxetine is not a vasodilator, it is a vasoconstrictor. Statement 2 is incorrect. Commonest benign tumor of placenta is chorioangioma. Chorioangioma is the most commonest benign tumor of a placenta. Dye that used for green tattoo, that is chromic acid. In case of iron deficiency anemia, what you will find? You will find serum iron, what? It will be decreased, and what iron binding capacity? It will be increased. Next question is that viscera should not be preserved in formaldehyde. Is it correct? Yes, it is correct. Extraction of a non-volatile organic poisons are become difficult. That's why it is remain in the formaldehyde. The statement 2 is properly explain the statement 1 assertion. Quickening is primary gavida. Primary gavida is seen in which part? 18th week of the gestation. What will be the normal level order? That will be your engagement, then your crowning, then your extension, then your restitution, then external rotation outside you. Powder bone are pathognomic for which condition? That is pelvic endometriosis. What is the placental previa risk factor? That is smoking is the risk factor, maternal age is more than 35, it is a risk factor, and your prior to puberty age is the risk factor of a placental previa risk factors. What is the carcinogenic factor and what are the types of ovarian histological tumor? Germ cell tumor is related to which part? That is teratoma of ovary. Surface epithelial tumor is related to serous cyst adenoma of the ovary. Sess cord cell tumor is related to areinoblastoma. Secondary ovarian tumor is related to Kuchenberg tumor. Next question is that old lady with having second trimester miscarriage, commonest cause of the same may be biconjugate uterus. It is the most triple test for include what? Maternal alpha fetoprotein, SCG, unconjugated estradiol. It is done in the week of 30 to 32 weeks, that is last trimester period. So both statement, first statement is true, that is fetal SCG, your unconjugated estradiol and your protein AFP is complete the triple test, but it is not usually done in 30 to 32 weeks. It is in between 16 to 20, second trimester. Next question is that Apgar scoring is contains which parameters? There will be heart rate, there will be color, there will be muscle tone, there will be reflex irritability. We will see in the Apgar scoring. A lady is suspected of a genital TB. The best time of a diagnosis of a uterine curettage is 1 to 3 days of menstrual cycle. Renal stone, which is a radiolucent, that is uric acid, not oxalate. Uric acid is the radiolucent. Among which organism intact in corneal epithelium, that is Corynebacterium diphtheria. Then Colling ulcer, which is seen in acute peptic ulcer, develops from after major burn. Next question is that pain due to uteric calculus is refers to anterior medial aspect of the thigh. It is correct. The common innervation of lower ureter and inner side of the upper part of the thigh is through genital femoral nerve. It is also correct. In deep inguinal lymph node is not comes out there will be painless swelling, that is a hernia, where you will see the coughing and reducibility is present. Swelling does not comes out coughing when deep inguinal ring is occulted. The probable diagnosis is what? It is about your indirect inguinal hernia. From ENT, that is Rinne test. Positive in case of a normal hearing, it is true. Positive in case of a sensorineural hearing loss, it is true. Negative in conductive hearing loss, it is true. Then negative in osteosclerosis, it is also true. Positive in perforation of a tympanic membrane, absent, it is false. A old cyclist which is comes in the road accident and brought to hospital, there will be streak of blood in the external meatus and he is unable to pass urine. So what is the most common causes? That is pelvic fracture. A 40-year colic pain in the abdomen, right upper quadrant of the abdomen, radiating backward, right of the shoulder. There will be food tolerance to fat and flatulence. What is the diagnosis? That is biliary colic. In second edition of organon, which is done, that is Latin word of order sapere was first time introduced. Regarding organon, there will be alternating action of the medicine, alternating various paroxysm of primary action. Statement 2, homeopathic cure takes place in the alternative action of medicine, it is wrong. In case of a higher potency, Hahnemann does not recommended because it causes dangerous consequences, which written in 276 upper gym. In case of narcotic substances, the symptoms are observed during which action of the medicine, that is a secondary action of the medicine. Diarrhea is 30% patient with having medullary carcinoma of thyroid. Medullary carcinoma of thyroid tumor cells are produced 5-hydroxytryptamine or prostaglandin. That is A is a true explanation of R and R ताकू explain करूँ. First English reporter was published in Allentown, that is Herring's reportory. 4 gradation was there in the homeopathic therapeutic of diarrhea in James Bell. In BBC, the shrieking screams, cries out paroxysmal is the medicine, that is Ignacia. Classes where the microorganisms are clinical material from human convulsions or disease subject, that is 4th type of coconut oil, then your olive, then your almond, lastly lanolin. In prescription part, the first ideal prescription, there will be 4 part. So prescription, inscription, subscription, signature. Signature part, there will be the advice and administration of a drug, how to do is written.